Hi there, and welcome to Histo with Ale. Today we're gonna talk about the very first and arguably the most important step in tissue processing, fixation. Fixation works by stabilizing proteins in tissue, making them resistant to further change. Fixation has many functions. First, helps on preserving tissue to prevent decay and autolysis. Second, stops enzymatic activity and stabilizes cell structures. And third, changes the cell's soluble components into insoluble ones, so they are not lost during processing. This stabilization happens through denaturation, which can be caused by chemical fixatives or physical methods like heat or drying. The chemical fixatives that we can find are additive fixatives and non-additive fixatives. We're going to talk about both. So first, additive fixative. The fixative binds directly to the protein, making it insoluble. An example of this is formalin. Non-additive fixative. The fixative does not bind, but it still alters the protein structure and makes it less water-friendly and more chemically reactive. Examples of this are alcohol or acetone. On the physical fixative side, we can find heat and drying fixatives like microwave ovens that can be used in histology labs to rapidly fix tissue samples using heat. The heat from microwaves causes protein denaturation, stabilizing the tissue without use of chemical fixatives. Another type of heat fixative is direct heating. This is mostly used in microbiology, not in histology. But when you take your microbiology lab class and you're playing around bacteria, they have you prepare a bacterial smear by briefly passing the slide through a flame. This process kills the bacteria and denatures their proteins, effectively fixing the cells to the slide for staining and examination. In histology, we rarely use this air drying method, but the smear is left to air dry without adding any chemical fixative. As the water evaporates, the cellular protein denatures, helping preserve cell structures. This method is quick and avoids using chemicals, but it may not preserve morphology as well as wet fixation for some stains. This method is used in ripe ginseng stain and fine needle aspiration. Why fixation is so important, you may ask. After talking a little bit about the theory, fixation is considered again the most important step in histology, because poor fixation can cause tissue to break, inaccuracy microscopic analysis, problems at staining, and so much more. This is like a domino effect. One wrong step and this could put the patient at risk. But when your fixation is done right, it preserves morphology, prevents shrinkage, and helps prepare tissues for embedding. In our next episode, we're going to talk about the factors affecting fixation and its quality. For more detailed explanations and examples, be sure to refer to the Frida Carson textbook. And if you're following along, do not forget to like, comment, and subscribe so you do not miss the next episode. Thank you.